Every woman over 60 has had this moment. You're getting dressed for the day, and you catch a strange smell. It's not your perfume, and it's not the room. It's you. You check your clothes, sniff around your underarms, maybe even rewash your towels. But it's still there. Faint, but unfamiliar. And suddenly, you're wondering, did anyone else notice this yesterday? Was this there at church? At the store? Or maybe it wasn't you who noticed first. Maybe it was your daughter. She hugs you a little tighter than usual, then hesitates. She doesn't say anything, but you feel it. That silent pause. That shift in expression. And something inside you sinks. You've always prided yourself on being clean, presentable, put together. But now? You're wondering what changed. It's one of those little things we don't talk about. But we should, because for many older women, a small change in how you smell is the first clue something deeper is happening. And too often, it starts in the place we feel safest, the bathroom. The routines we've trusted for years, how we clean, how we eat, how we handle our most private moments, can slowly turn against us. And no one tells us until it's too late. What I'm about to share could be the difference between quietly suffering through discomfort, or taking back control of how you feel, how you age, and how others see you. In this video, you're going to discover 8 everyday bathroom habits that can make older women smell bad. Not because they're unhygienic, but because aging changes everything, from skin pH to muscle tone to what bacteria thrive where. These aren't just cosmetic issues, they're warning signs that your body needs something different. And I want you to stay with me until the very end. Because the final habit, number 8, is the one 90% of families overlook until it's too late. It's not about soap. It's not about food. But it could explain why so many women struggle silently with changes in odor and don't get the help they need until they're hospitalized. If you're concerned about maintaining your dignity and independence as you age, subscribe to Elderly Health Central now, because this channel gives you the medical insights your doctor doesn't have time to share, delivered with the respect you deserve. And if you're ready to take charge starting today, comment below, "I'm ready." Because the truth is, you're not alone. And the answers you need start right here. Let's begin. You might think skipping protein at breakfast is harmless, especially if you've always preferred something light, like tea and toast or a piece of fruit. I get it, it's comfortable, familiar, and easy to prepare. But here's why it can quietly affect how your body smells. As we age, our muscle mass naturally decreases. But if your breakfast is low in protein, your body begins to break down muscle tissue to find fuel. That process releases metabolic byproducts, like ammonia, that can change your sweat and breath. You might notice a sharpness in your morning breath, or a faint ammonia-like odor on your skin. It's subtle, but over time, those changes accumulate. Research shows older adults need more protein per pound of body weight than younger adults to maintain muscle and organ function. Yet many fall short, especially early in the day. And here's the caregiver part. Families often encourage light breakfasts thinking it's easier or healthier, not realizing it's setting the stage for both smell changes and a weakening immune system. What you can do instead is straightforward. Aim for at least 20 grams of quality protein at breakfast, like Greek yogurt, a couple of boiled eggs, cottage cheese, lean turkey slices, or even a simple protein shake mixed into oatmeal. If digestion is a concern, smoothies are gentler. Over time, you'll likely notice steadier energy levels, stronger muscles, and yes, fresher mornings. Next, let's talk about underwear. It's easy to think, if I didn't sweat or leak during the day, why not just sleep in my underwear tonight? But our bodies shed oils, bacteria, and dead cells constantly. Underwear, especially synthetic kinds like nylon or polyester, traps that moisture against the skin. And sleeping in it gives bacteria all night to grow. Result? You wake up with a musty or sour scent in your intimate area, and perhaps on your bedding. Unfortunately, families often misinterpret this as normal aging, not bacterial overgrowth. The fix is simple: before bed, change into a clean, breathable, cotton pair of underwear. If incontinence is a concern, opt for specially designed, odor-controlling liners or undergarments. Nighttime briefs with breathable fabric. Skin-friendly pads, changed at bedtime. Changing underwear isn't just about comfort, it's about preventing irritation, infection, and loss of dignity. For many older women, this one small habit restores freshness and supports confident sleep. Now, consider over-the-counter scented soaps and wipes. It seems logical: if something smells, scrub it harder, or spray more fragrance. But here's the problem: aging skin is different. Lower estrogen means thinner skin, less natural oil, and changes in pH. Harsh soaps, fragranced wipes, or antibacterial cleansers can strip away protective barriers and beneficial bacteria, especially in delicate areas like the vagina. This imbalance can lead to dryness, burning, irritation. Worse, it often triggers a rebound effect: more bacteria, more odor. One study looked at women over 60 who used perfumed hygiene products and found they had twice the rate of skin issues compared to those who didn't. Families frequently buy fresh or antibacterial products, thinking they're helping, but sometimes doing more harm than good. What to use instead? Go with fragrance-free, pH-balanced cleansers made for mature skin. Clean gently with lukewarm, not hot, water, and pat dry, don't rub. If your loved one suffers from dryness or recurrent irritation, ask their healthcare provider about products containing mild glycerin or ceramides. And if sensitivity continues after switching products, that's a clue it's time for professional advice. Here's another habit you might not even notice: delaying bathroom visits. Life gets busy. Getting to the bathroom may take time or effort, especially in the dark or when mobility is limited. Holding in urine occasionally may seem fine. After all, it's just urine. Except that when urine sits in the bladder too long, bacteria have more time to multiply. And that leads to urine that smells stronger, sometimes even acrid or musty. In older women, urinary tract infections from delayed voiding are a leading reason for hospital stays. What seems like just a long holding often reflects weakened bladder sensations or habits formed around convenience. But the odor tells the story. Families sometimes disregard it, assuming it's incontinence. In reality, frequent strong-smelling urine is a red flag. Solutions are more manageable than you might think. Practice urinating every 2 to 4 hours, even if you don't feel the urge. Keep hydrated, targeting clearer urine. Light yellow is ideal. Encourage bathroom access to be smooth, install night lights, place pots near the bed, and reduce fall risk with grab bars or no-slip mats. Drinking water and regular voiding together help flush the urinary system, reduce bacterial growth, and keep things quieter and fresher. Let's talk about something far from your nose, but surprisingly relevant: feet. They're often overlooked in a daily hygiene routine, especially if bending is difficult. But older women frequently experience foot odor and fungal buildup because moisture and dead skin accumulate between toes. If your feet don't feel itchy or look infected, it's easy to think they look fine. But under the surface, bacteria and fungus can thrive, affecting skin health and sometimes even mobility. A geriatric care study found that foul foot odor and fungal infections often marked the earliest stage of hygiene decline among senior women. Families often dismiss foot smell as just being old. But foot cleaning care is part of dignity and independence. What helps? Use a long-handled brush during showers to clean all surfaces, even with limited bending. After showering, dry feet thoroughly, with focus between toes. Wear breathable socks, ideally cotton or wool, and alternate shoes to allow drying. If fungal nails or skin cracking appear, over-the-counter antifungal sprays can help, but persistent issues should be evaluated by a podiatrist. Clean, dry feet can keep shoes and even the whole home smelling fresher. Stress can also affect how you smell, and that's often overlooked. Emotional stress triggers apocrine sweat glands, located in armpits and groin, to produce a thicker, protein-rich sweat. Unlike ordinary sweat, this tends to be odor-prone because bacteria feed on it more readily. And as we age, those glands can become more reactive. Stress for senior women isn't trivial. It may stem from caregiving roles, loss of loved ones, health worries, or isolation. And that internal tension can sneak out through body scent. Families may misunderstand this as a hygiene issue, when really, it signals emotional strain. Here's what you can do: incorporate short daily stress relief rituals. Whether it's 5 minutes of deep breathing, a favorite safe activity like knitting, gentle exercise, or soft music, it matters. Social contact too: phone calls with loved ones, church attendance, visits from grandchildren, they all lift mood, and lighten stress-derived scent. If stress feels overwhelming or persistent, a provider can guide you toward counseling, mindfulness, or support groups. Emotional wellness is just as crucial as physical care. And being aware of how it affects your body is empowering. Another sneaky culprit: sitting on damp bathroom surfaces. Here's how it happens. After a shower, many people sit on the toilet seat or edge of the tub to dry off or dress. What they don't realize is that those surfaces may still be damp, or haven't been cleaned recently. When your skin parts press against them, moisture and bacteria transfer. Over time, those contact areas can develop a subtle milk-like or musty smell, and increase the risk of skin irritation or mild infections. Fortunately, the solution is simple: after using the shower or tub, wipe down the seat and edge, and place a fresh, dry towel on the surface before sitting. Wash bathroom chairs, mats, and towels regularly, especially if anyone home bathes or sits there. A clean foundation prevents microorganisms from building up. And for seniors with limited mobility, this quick wipe and pad routine is a dignity-saving hygiene habit. And now, here's the most crucial insight: ignoring new or changing body odors as just normal aging. This is the biggest mistake. Because odor is often your body's earliest warning system. A sudden ammonia scent in urine may hint at kidney strain. A fruity or sweet skin smell might signal diabetes. A musty odor could suggest liver metabolism changes. Or persistent body odor might hide a chronic infection, long before pain or heat tells the story. Studies show that older adults who ignored new body aromas were significantly more likely to need medical attention within the next 6 months. Sometimes within weeks. Yet often, embarrassment, assumptions, or the idea that smell is part of old age keeps these signals hidden. Here's what you can do: start a scent journal. Keep small notes in your bathroom or phone whenever you notice an unfamiliar smell, and note context, time of day, and possible factors. A pattern may emerge. If something new persists, even subtly, even if no other symptoms appear, it's time to mention it to your healthcare provider. You're not being overly cautious, you're responding to early communication from your body. And that's an act of caring, not complaining. All of this leads to an important message: aging with dignity isn't about avoiding every change, it's about listening, responding, and staying in control. You're not a passive bystander in your own health journey, you're the lead. And these bathroom hygiene habits aren't just about cleanliness. They're about staying confident, avoiding preventable infection, protecting your sense of self, and preserving autonomy. Think about this: fresh underwear, morning protein, gentle cleansers, regular bathroom visits, clean feet, stress relief practices, dry bathroom surfaces, and paying attention to unexpected scents. These 8 steps aren't complicated, but together, they build a foundation for strength and independence. If one even came as a surprise to you, ask: could it be relevant for my daily routine? If the answer is yes, it's worth trying. Every small change signals care, for your body, mind, and sense of dignity. Because your health really is your wealth. Before we close, here's your reminder: subscribe to Elderly Health Central. Our community is about empowerment, not fear. If you'd like help choosing senior-friendly skin care, navigating nutrition changes, or managing bladder health, that's exactly what we do here. And we post new, practical insights every day. What about you? I'd love to hear your experience. Have you or your loved one noticed body odor changes? Maybe after an illness, a new medication, or a lifestyle shift? If you feel comfortable, please share in the comments below. Your insight could help someone else recognize their own body's signals. And don't miss our next video. We'll be talking about a bathroom habit that can silently weaken bladder control, and how you can stop it in its tracks tonight. It's something most people do, and yet 80% of senior women don't realize its impact until it's too late. Remember, your body is talking. When you respond with care, you affirm wisdom, empowerment, and self-respect. Your health is your wealth. Invest in it wisely, kindly, and visibly. I'll see you next time on Elderly Health Central.